Well, this letter on Medicaid says it suggests that they're not going to vote for Medicaid cuts. Unfortunately, that's not the case. If you read the letter, they say they're not going to cut Medicaid for vulnerable populations or this population or that population, but it doesn't rule out cuts in Medicaid. One of their colleagues, a Virginia colleague, said that when the Energy and Commerce Committee finishes their work, they will vote for the budget. The fact of the matter is the budget cutting Medicaid is necessary to help fund tax cuts for billionaires. And that's the choice. So we're going to have tax cuts for billionaires and pay for them with cuts in Medicaid, food services, and education, or we're going to have a more progressive budget where you actually improve education, improve health care, and maybe the billionaires don't get as much tax cuts as they want.
But do you think that there's a possibility that there are 12 members of Congress right now who are saying, I can't face my constituents at home and cut Medicaid?
Well, the fact of the matter is they voted twice to cut Medicaid because we had the budget framework. CBO said it guaranteed that Medicaid would have to get cut. So that we'll just have to see as the budget goes on what the numbers are on line items. But CBO said that the budget framework requires cuts, massive cuts in Medicaid.
Congressman, they say they want to protect vulnerable populations from Medicaid cuts, but the way I see it, Medicaid is designed to protect vulnerable populations. That's its single greatest service. Can you cut Medicaid while also protecting vulnerable populations?
Well, it depends on what they mean by vulnerable populations. The fact is that over 600,000 people are covered by Medicaid expansion. 1 out of 5 Virginians are covered by Medicaid. So we'll just have to see what they ultimately mean by cuts vulnerable population. And as you start defining it, you probably mean red tape and people who are actually vulnerable can get the paperwork done, and that's where you end up.
So where does this leave your constituents if you're saying that these 12 members in the end will vote to cut Medicaid?
Well, we'll have to see. We've had 2 votes on the budget that included massive tax cuts for the wealthy and cuts in Medicaid, according to the CBO. It passed virtual party line vote both times, and so we'll just have to see. I don't think, I'm hoping that they will not vote to cut Medicaid in order to fund tax cuts for the wealthy. The ironic thing is, even after they've cut Medicaid, cut food services like SNAP, education services, to fund tax cuts for the wealthy, they still end up with a budget that from a deficit point of view is worse than doing nothing.
Let's talk about some other things that are in the headlines, specifically what has happened to higher education, your alma mater, Harvard University. They're threatening to snatch their tax-exempt status.
Well, it's not clear to me that the president has the discretion to decide who gets the tax-exempt status or not. It's a matter of law, and you can't use this as a bargaining chip to coerce people to do what you want them to do. We'll just have to see. The colleges are beginning to resist, and I don't think they're going to be able to use tax-exempt status as a form of coercion to make people do what they want to do.
But is this a broader assault on the First Amendment?
Well, the entire administration for the last almost 100 days has been an assault on the Constitution. There have been over 100 lawsuits filed, many of them successful. They're pending right now. Judges that are in the process of determining whether or not the administration is in contempt of court. So we'll let that legislation play out.
Are we watching?
Sorry, Regina, do you feel like Harvard standing up to the president will set an example for other higher learning institutions to follow?
Well, we certainly hope so. The administration has demanded that colleges do things that are unnecessary under the Constitution, and using things like federal funding and apparently a tax-exempt status as part of the coercion. So we'll just have to see how that works out.
Personal level, what's it like for you to see some of these really important things come under such threat?
It's heartbreaking. The thing about service is there's a level of certainty with it, right? You join, you know that you're serving, you're going to be taken care of. we've gotten to a better place where you get out, you feel a high level of certainty on most things. And what we're seeing now is just like put so much uncertainty in the eyes of people that I know have seen so much worse. So it is heartbreaking, but also empowering in a way, because it's like, I get to be in this fight. Like, I get to. It hurts, but I get to do it. And I'm grateful, but also I'm kind of pissed that we're doing it. I don't know any other way to say it.
Yeah, and I think you said something along the lines of when a veteran reaches out their hand for help, oftentimes Medicaid is the only hand that's there to grab.
Yeah.
So if Medicaid isn't there to grab, what happens?
I mean, logically what happens is that is a safety net. The VA doesn't fill all the gaps, and quite frankly, not a lot of veterans choose to use the VA. Not a lot of veterans have access to TRICARE in the way that I'm fortunate to have access to. So they stop getting their prescription drugs. They stop getting that care that they're seeking. And as you heard, it is life or death for some folks. So that's what happens. You go broke trying to stay healthy, or you pay for the things you need to just live and miss out on other things like paying that light bill, paying that gas bill, paying rent. These are impossible choices. It's just so frustrating to see it. And the only word I can think of is such a high level of certainty for a population that is so small. We're less than 1% of the population that put all of these things on the line. I'm sorry, I'm like over talking, but like as a veteran, when I got out, it was the first time that I recognized myself as a mom. Like as a actual something outside of the uniform. Like I became a person, and it was hard because I had to take care of that person in a real way. And once I found these systems that supported me in a real way, I sort of got my footing and got out of mourning. And then to have things like this happen, I see that in other people, that you're just now getting your footing, trying to be a normal human being outside of the uniform, and then the rug gets snatched up under you. That's when the substance abuse comes in. That's where the mental health comes in. Because I tell you, I've been triggered to snap back into old habits too, because of the stress of things. So this is hard to watch, but it's so real for so many people, for the veterans community and en masse.
And hard to predict the future, but it seemed as though you indicated you're confident that at the state level, you guys will do everything you can to fill any holes left by the federal government.
At the state level, we obviously are going to do everything that we can. I mean, you can just see it in the negotiations we just had with the budget. We are trying to take care of the people who do the most service for us, educators, veterans, first line. Like, we are trying to take care of folks that keep our society whole. We're going to do our best. Are there hard decisions that's going to have to be made? Absolutely. We are in an unprecedented time. It's not just the state budget, it's the local budgets that are just in turmoil. We don't know what we don't know, but what I do know is the work that we're going to put in to take care of folks and to make sure that they're not having so many impossible choices to make.
Good morning. Good morning, and I want to thank everyone for coming today. This is an important meeting as we discuss whether or not there will be Medicaid cuts and adversely affecting our constituents' health care. Regrettably, the cuts are being discussed only in the context of funding tax cuts for the wealthy. But today we'll hear from both Medicaid beneficiaries and experts on how Medicaid cuts will affect our constituents, particularly military and veterans families. And we'll unveil a new report from the Commonwealth Institute detailing how these proposed cuts will specifically affect veterans and military families. We've heard a lot of discussion about whether or not the House budget, the congressional budget, will affect Medicaid. The fact is that the budget requires the Energy and Commerce Committee to find $880 billion in cuts. Technically, it doesn't mention Medicaid, but as CBO points out, there aren't $880 billion worth of programs in the Energy and Commerce Committee jurisdiction without going deeply into Medicaid. And so whatever the rhetoric is, the budget right now requires cuts in Medicaid. Now, we've heard some word games being played that some are now saying they will not cut Medicaid, but then if you read the fine print, it's they won't cut for vulnerable populations. They will vote to improve the program, whatever that means. Basically, I think it means that you're going to cut Medicaid. We know that that would represent a devastating impact on people in our country. I mean, millions losing their health care coverage. Hospitals and nursing homes across the country could be forced to close. These cuts could hurt children, families, pregnant women, hurt seniors, Americans with disabilities, all of whom rely on Medicaid to see a doctor or lead their best possible life. And it was highlighted today, veterans and military families will not be spared. As a member of the House Budget Committee, I opposed the Republican budget resolution along with every single Democrat on that committee. But let's be clear, the ultimate goal is to cut Medicaid in order to fund the massive tax cuts for the wealthy. And Medicaid provides coverage for 1.7 million residents in Virginia, 1 out of 5 of all Virginians. In the 3rd district, that's over 250,000 people who are at risk of losing their coverage under the Republican plan. That's 250,000 people who will not be able to pay their hospital bills or purchase prescriptive drugs when they get sick. As I mentioned, we're joined here today by the Commonwealth Institute. They will share their brand new report on how Medicaid cuts will hurt our veterans here in Hampton Roads and across the country. As the report details, Medicaid serves as a critical safety net for military families. About 850,000 people enrolled in Medicaid have TRICARE as their primary source of coverage. Around 10% of active duty service members with TRICARE also have Medicaid coverage. For active duty family members with special or mental health needs, Medicaid covers supplemental benefits not available through standard TRICARE package, including rehabilitative services and limited respite care. Medicaid's key pediatric benefit has its roots in ensuring the nation's military readiness. A 1964 White House study showed the high rates of military draftees were disqualified from service due to preventable conditions during childhood, which led to the development of Medicaid's pediatric standard of care, known as early and periodic screening, diagnostic, and treatment. We are also joined by Bryant Thomas from the Children's Hospital of the King's Daughters in Norfolk. He'll go over the pediatric side of how many patients at the Children's Hospital in Hampton Roads who are served by both TRICARE and Medicaid. Now, Democrats expanded Medicaid when President Obama signed the Affordable Care Act into law. Thankfully, Democrats in Virginia were able to expand Virginia as the ACA intended, extending coverage to over 300,000 people in the Commonwealth in the first 8 months, and now ultimately well over 600,000. Under expansion, Medicaid covers more Americans who do not make enough to afford private coverage, and it expanded access to coverage for women and infants. There was what's called the Medicaid gap, those who didn't make enough to get into the Affordable Care Act marketplace, but didn't make little enough to qualify for Medicaid as it was then established. However, we know that additional steps are needed to close other gaps that remain in health care coverage. Now, there are a number of ways that Republicans could come at Medicaid, and they're all very concerning. But the most trouble is what is the effect it might have on Medicaid expansion. Virginia is what they call a trigger state, which means that the federal funding is jeopardized. We could lose coverage for all of the over 600,000 people who are now on Medicaid unless we refund it some kind of way. As a member of the Budget Committee and the ranking member of the House Committee on Education, I'm fighting back against these cuts. The Republicans have the majority, so we have to do everything we can to make sure the voices of Virginians are heard on Medicaid. And we have an administration, and we have seen the administration caved to political pressure before, and so we must not relent. And then we have some advocates, providers, and veterans with us today who are going to discuss how deep Medicaid cuts are going to hurt these who have served our country, all to pay for tax handouts to the very rich. Many of the Republican colleagues voted to move this terrible budget framework forward last week, and are suddenly now saying they're not going to cut Medicaid, but the time to have said that was last week, where the budget framework only passed by one vote. Many of the Republicans voted for that, and so we're going to do everything we can to continue making those votes difficult and hopefully defeating it when it comes back with the numbers on the actual line items. So we're joined by a number of people, and I'm going to have them make remarks, and we'll begin with Delegate Jackie Glass from Norfolk, and she is also a veteran. Jackie.
Gratitude. Well, first off, thank you all. Thank you, Congressman Scott, for having me here today. What is happening is absurd and, quite frankly, disheartening from the perspective of a citizen legislator. Even trying to get some of those veterans affected here today was a challenge because they are now looking for employment. What I think needs to be underscored, and as we have this conversation, is the vast majority of folks that enter into military service don't retire. So they don't end up with that benefit. The vast majority of folks choose not to get involved with the VA for one reason or another. I could say I'm probably in that population that has had my fair share of gripes. We are removing a lifeline. Not we, Republicans, are removing a lifeline that I think is already having a very chilling and rippling effect on veterans in the Hampton Roads community. I think we're at a point where we're at a time where, as someone who is looked to for leadership, I feel like my heart breaks because the number of veterans that have said to me that I don't know what I'm going to do, the number of caretakers that have said, I don't know how we're going to make it through this. That too has a dire effect on what the Congressman just spoke on: mental health, physical health. So just the fact that we are in this conversation with people who I don't think our oath ever expires. I don't think it ever expires. To put them into this sort of turmoil is it feels very violent and traumatic. And for people who I don't know that any of these Republicans that are doing this understands what it means to actually be property of the United States of America. And that is what service is. And so to provide a service where we're not giving everything they need, and there is a dire sort of need for Medicaid and Medicare, and to snatch this away from those who, again, were at one point the property of the United States of America, because that is what service is. I can't underscore that enough. It is a fight. It is an all-out fight. And as a veteran, I'll say, not on my watch. I'm here for it. I'm grateful that you convened us here, and I look forward to learning more about what TCI and the rest of the folks have so that we can get into this fight.
Thank you. Thank you. We're also joined by Freddie Mejia?
Mejia, yes.
Mejia. Freddie Mejia from Medicaid.
Yeah, thank you again for the invitation, Congressman Scott. My name is Freddie Mejia. I'm Policy Director at the Commonwealth Institute. And we worked to find some numbers to support what many in this room already know, that Medicaid is critical lifelines to veterans as well as military families. So we found that over 56,000 individuals, including active duty members, Some veterans and their families are dually enrolled in both TRICARE and Medicaid. And Congressman Scott alluded to why that is. TRICARE has some limitations in terms of what they serve, and when we're thinking about particularly children who need extra supports, things like waivers, home and community-based services, those are really critical supports that Medicaid is able to offer these individuals, to these families, and really support where TRICARE ends, Medicaid can pick up where that is ending. We also know that beyond the TRICARE and Medicaid dually enrolled population, veterans rely on Medicaid. We found that over 47,000 veterans have Medicaid. That's nearly 1 in 13 veterans in Virginia, and many of whom live here in the Hampton Roads area, access health coverage through Medicaid. These individuals may be adults working low-wage jobs. They might be caring for a loved one at home. We know many people are in the sandwich generation, taking care of their older parents and their young children. They might be parents that decide, I can take a part-time job right now in order to support my family like I need to, while making sure I have health coverage to take care of myself. I think back to that letter that Congressman Scott shared and talked about earlier, and vulnerable populations. Well, I ask everyone in this room, those individuals that we just laid out, are they not vulnerable? Because if any cut to Medicaid expansion happens, those individuals will lose coverage immediately here in Virginia. That's over 600,000 individuals. It brings me back to a story that a good friend, Aida Pacheco, shared with me, that her adult daughter actually accesses health coverage through Medicaid expansion. She's currently fighting cancer, and she's unable to work. And Medicaid expansion has been that lifeline for her. Without Medicaid expansion, she would not be eligible. So we turn the clock back to 2017, when we were here in Virginia without Medicaid expansion, she would be left with little to no options. And unfortunately, due to some conversations and votes really at the federal level by congressional Republicans, we could be turning back the time here in Virginia to a point in the moment where many people, like Aida Pacheco's daughter, will not have options, even though they're fighting for their lives and fighting for the opportunity to work to make life better for themselves and really support their families in the best way that they can. So once again, we know that Medicaid is a support to many military families and veterans. We have some numbers now, some data to put some numbers to that, because sometimes we love a little data and a little numbers with these stories. But again, we have incredible individuals here as well that can share some stories as well that will back up some of these numbers as well. So thank you again for the invitation.
Thank you so much. Shore Rural Health System, who provide care for the Eastern Shore to veterans, and she is in fact a veteran herself. Dr. Lindgren.
I'm a trained physician. I've been with Eastern Shore Rural Health for 19 years, the Chief Medical Officer since 2021. Eastern Shore Rural Health is the federally qualified community health center on the Eastern Shore. We run the length of the peninsula, providing primary medical, dental, behavioral health, and pharmaceutical care to 70% of the 45,000 residents on the Eastern Shore. I am also active with the American Legion. I am the first vice president of the American Legion Post 100 in Parksley, as well as for the 1st District, which is all of the Eastern Shore. I'm also the mother of a Navy surface warfare officer and the mother-in-law of an Army military police officer, both of whom are VMI grads. So I am very invested in both the veteran and the active duty community. Eastern Shore Rural Health cares for veterans. One of the most interesting things, as was previously alluded to, is identifying exactly who is a veteran. To try and address that, we are actually holding an event on May the 10th, which we're calling Stand Up and Be Counted across the Eastern Shore. because the best numbers we can come up with right now is that there are between 3,000 and 5,000 veterans on Eastern Shore. I can tell you that Eastern Shore Rural Health can identify 1,800 of our patients that are currently veterans, but I know that number is woefully low. And that's, again, because many veterans who have not done 20 years and are not eligible for the full benefits don't recognize themselves. So we have changed the question we now ask, which is, have you served, not are you a veteran? Because that helps identify that population much better. We also know that we provide dental care for many veterans who are on Medicaid, because there are no benefits, dental benefits, even for those who are eligible for some medical benefits. So again, this is something that is very, very near and dear to my heart personally, as well as in my position in rural health.
Very good. Thank you so much. Brian Thomas, notice over in Norfolk. Brian?
Yes, sir. Thank you for inviting me to this very important conversation. My name is Brian Thomas. I represent Children's Hospital The King's Daughters. For those that might be unfamiliar, we're an integrated pediatric health system located in Hampton Roads. We serve all of southeastern Virginia, Hampton Roads, and northeast North Carolina. Our main hospital facility is located in downtown Norfolk. It's a 206 inpatient bed facility. We recently just opened, with the support of Congressman Scott as well, a 60-bed pediatric mental health hospital. So when we're talking about vulnerable populations, specialty care, that's right in our wheelhouse. This is it's an important topic to us because it uniquely impacts kids in Children's Hospital. We're the only freestanding children's hospital in the state. We have a very large Medicaid population. About 57% of our patients are on Medicaid, and then another 14% of our patient population is on TRICARE. So, we do have some of those dual enrollees that receive services at our hospital. So, when we're talking about cuts to the Medicaid program and potentially diminishing what that benefit looks like, that's directly going to have an impact on us, how we're able to operate, access to care. And you're talking about mission readiness, retention and recruiting of our active duty military folks. I think all of these things are connected. So, we do have a lot of concerns about the potential cuts that could come through in the reconciliation package. So very much appreciate having these important conversations today.
Thank you. It's good to see you today.
It's good to see you.
Thank you so much.
Thank you for having us. And so I am Joan's counterpart in Southeast Virginia. We have 12 primary care sites located throughout Southeastern Virginia, from Franklin to Virginia Beach to Newport News. And so as I sat here listening, I guess you would call us federally qualified health centers. We're the gap. We cover the gap. So whereby anyone falls short with regards to needing health care, that's what community health centers were developed to do. So if someone's uninsured, you might have someone who's underinsured, they have insurance and they just don't have enough. So what happens with our individuals who are military or who are veterans and they have TRICARE, maybe TRICARE doesn't cover everything. So then they come to us. So it's very much needed, got to put these peepers on, for healthcare coverage for veterans and military families who may not qualify for the benefits from the VA or for TRICARE. But it also includes healthcare, importantly, substance use disorders and long-term services, support services for that population. Mental health, we can't talk enough about mental health. And that is significant that we are finding for our military population that we serve throughout Southeastern Virginia. And of course for our children, as Mr. Thomas has already said. But I thought about it and I said, oh my goodness, a story. I have a story. I have a personal story. And so sometimes you don't realize that you're living it every day. My uncle is a veteran. He's 70 years old. My mom was his caretaker and she passed a few years ago and I inherited my uncle. So my uncle served in the Marines and as a result he developed some mental health issues, adult onset schizophrenia. In his later years, due to substance abuse, he developed he had multiple strokes, and so he has all the chronic issues related to the substance abuse and to the multiple strokes, and we are the caretakers for my uncle. And so he is fortunate enough, through Medicaid expansion, that he has Medicare and Medicaid, which he needs. He needs all of those services. So all of the support services that he receives, he needs. And if Medicaid goes away, he won't have those services. Most recently, we were dealing with some weight loss issues, and he needed to have CAT scans. The VA was not able to meet those needs. We were on a waiting list for more than a year to get a simple CAT scan. So they had to send him out to what they call community. And so we ended up going to Centera, but because of his Medicaid, he was able to go to Centera and have all of those services that he needed. Now we're looking into long-term care. And so that's on the table. If long-term care is cut, those services are cut, what's going to happen to my uncle? I'm no spring chicken myself, and I'm the primary caretaker, so that is really concerning for me as I try to plan for his care long-term. So it has such vast effects, anything that happens to Medicaid for our military populations, and I know each person around this table has their own story, so we need to do whatever we can to help support Medicaid continuance for our military population. And thank you again for being here today.
Thank you. Hitchbeth is a veteran and a member of SEIU Local 512. He's also a Medicaid-funded home care provider. So can you tell us about yourself and the work you do?
Good morning, everyone. Thanks for having me here, Congressman Scott. I represent Service Employees International Union. We have over 3,000 home care workers who take care of the elderly and children with disabilities, family members. Also my other head is also the Veterans Hat. In regard to, I take care of veterans with disabilities, veterans that have been injured during service to this country. And like Delegate Glass was saying, we have the oath breakers. I consider myself an oath keeper. We're the line of defense who helps maintain the stability in our system. SEIU, we also protect working families. We're here to combat systemic racism within the system, so the families can get the help they need for their family members. Let me tell you about veterans. Veterans are some of the most humblest people in the world, but they can be some of the most volatile people in the world. Veterans are trained killers, basically, but we have learned to harness this aggression. But when we hurt. And when you start taking away some of the fundamental things that we were promised, it hurts. People have been injured. They need their equipment. They need their care, their ongoing care. And if you're denied that, what's left for them? What are their options? That's what we're here. That's what we're here to combat. Don't take away our Medicaid. Don't take away our system that we depend on. Most veterans live on paycheck to paycheck, and the end of the money comes before the end of the month. So when you start talking about taking away their survival system, their mental health is going to be affected. So we need to do everything we can to stop this steal, stop getting our money to the wealthiest and give it to the ones who serve their country, the real Americans, who serve their country and expect their country to return them, to keep their word and give them what they promised. That's what we need. Thank you for your time.
Well, thank you. They didn't have Medicaid. How would they pay for the services that they need?
They're out of pocket. Out of the couple of $100 that they. Some of them don't get a full retirement. Many veterans haven't gotten their VA compensation. Vietnam veterans have been fighting this since the Vietnam War ended. They're still fighting to get their compensation. So I'm taking care of World War II veterans, Korean War veterans, and also the Gulf War veterans. So if they don't have, without their support system, they will have to pay for it out of their pocket.
Do they have the money?
They don't. They don't have the money.
So they don't get the services.
They don't. That's another thing. Their services will also be cut. They won't have anyone to take care of them.
I'm sorry, Congressman Scott, and I forgot to add, and I'm sure in your centers, we see homeless veterans.
Yeah.
And that breaks my heart every day,
Yep.
that folks have served our country and they are homeless, living on the street, living in tent cities. And so when you're homeless and you're dealing with the mental health issues and the substance abuse issues, it's a chore just to try to find them, to make sure that they have the medication that they needed. And true story, we just had a veteran who
Oh, correctly, and I think I've felt this sentiment in the community, is that when a veteran reaches out their hand for support, oftentimes the only hand that is extended is Medicaid.
Yes.
Brian, what advantage do military-connected personnel have if they have both Medicaid and TRICARE rather than just TRICARE alone?
Well, most of the instances where you're seeing Medicaid used as a secondary insurance is when there's some patient responsibility left on a hospital bill. So, that's to say TRICARE will be your first insurance, but will only pay up to a certain amount. Then Medicaid will typically come in and pay the rest. How that's helpful is to make sure that these families that are coming, a lot of the times from out of the area to receive the specialty care that we offer at our hospital, don't have any sort of financial implications left over after they have their child stay with us. So, any sort of diminishing of that Medicaid benefit, and we're also seeing some challenges with policy changes on the TRICARE benefit as well, impacting the reimbursement rates on some of our outpatient services. So, we're really starting to see issues with access to care, and then also just putting more of a financial pinch on families if they're not able to get that full reimbursement for the services that they come to see us for.
It's the death rate, if you have insurance and don't have insurance?
Yes, I mean, the research is clear that having insurance helps you with early intervention with chronic diseases and make sure that you can see a doctor before a situation becomes too serious. It's having insurance saves money in the long run because you can triage those issues early on, and most people, if they don't have that money to go to the doctor, they will put that off until it's an emergency. And when it's an emergency, emergency departments bear that burden. It's costly for everyone involved, and ultimately, if there's uninsured population that's going to the emergency department, as we saw at higher rates before expansion, that cost gets spread around through the state, as well as the individuals that have insurance who are not even on Medicaid.
The following year. If expansion is jeopardized and they have to pass it again, how likely is that?
I think if we do our job this November, it's highly likely that let me say this as a veteran, it is very difficult to politicize things. It's really challenging, but this really is the situation that we're in, is that we have the folks, a slight majority that would support and understand that our role, we have a moral responsibility here at the state level. And so making sure that we, after November, maintain our house and have this on our desk in a way that we're able to be supportive. I think I don't see the General Assembly turning its backs on veterans or families in any way, in any possible way.
And if I could just add to that, I think we also need to look at it holistically as well, because even if the trigger law comes into effect and you have to pass it again, if there are still cuts at the federal level, whether it be per capita caps, block granting, what have you, those holes will have to be filled in the state budget. We already saw the impact that had this year when the Medicaid forecast was short $680 million, and how difficult that was to fill on a one-time basis. Now, if you're talking about billions of dollars of cuts that might impact, our biennial budget next year, it'll be a real challenge to backfill that. And then now you're talking about impacts to coverage in the Medicaid program. You're talking about impacts to rates from the Medicaid program. And then all of that sort of rolls downhill into our access of care and what services we're able to offer as well.
Now, Medicaid was not expanded for many years, and it was only when you had one party in control of the governor, House, almost House and Senate, that you were able to get close enough to expand. If you didn't have a governor willing to sign the bill, or a House or a Senate not willing to go along, you run into real problems. And 600,000 people will have their health care in jeopardy. Brian, you mentioned several of the ways you can save money. What if you had a work requirement? What effect would that have on people that would be eligible even after the work requirement?
Really good question. Because pediatrics is unique, right? So, our Medicaid patient population has been pretty constant even before expansion, right? So before expansion, we were actually a little bit higher, 58, 59%. Now we're about 57%. So, generally speaking, kids were able to be put onto the Medicaid insurance. But when you're talking about taking a look at how that impacts the whole family, then you're really talking about some implications that might be having some unforeseen consequences, right? So, can your child be healthy and have a healthy upbringing if, mom can't go to her mental health appointment because now she's not qualified under Medicaid? Or if mom and dad or, someone else in the family is sick, they can't get health care? Are you really taking your child to get their wellness check and keeping up with everything they need to do? So, that's one of the ways that I've been looking at this from sort of a holistic point of view, is that, yes, there's going to be direct implications on our business and how we might be able to operate, but, it impacts adults as well. And if the adults are impacted, then the whole family is impacted.
I don't mind jumping in on this as well, because work reporting requirements is something that is very concerning to us. As many may remember, when we decided to expand Medicaid back in 2018, there was actually a state-level work requirement proposal that was along with that. And we are so thankful that Virginia lawmakers heard from their constituents and saw the research that work requirements don't work. How do they save that money? It's kicking people off of coverage. And oftentimes, they're kicking people off of coverage who are working, who are caring for a loved one, who thought that they submitted what they needed to submit one time and then found out that they had to do it 2 or 3 more times. So, there was only a couple...
Or people who are disabled and eligible not to work
That part.
can't get the Medicaid until the paperwork is straight.
People fall through the cracks, and when that happens, people lose coverage and people lose their lives. So we know that work reporting requirements is just another barrier, another hoop to jump through in order for people to just access prescription drugs, go get their wellness checks, do what they need to do in order to take care of themselves so that they can work. Health coverage is a work support in and of itself, and cutting coverage is not going to lead to any positive work outcomes. And so far...
Wait, you said it doesn't lead... The studies show that people don't work more often with the work requirement?
That's correct. There's 2 states that have kind of gone down this pathway, Arkansas and Georgia. And so far, there are no outcomes that say that these work reporting requirements have increased any type of work outcomes for the individuals that they were supposed to. So,
but it does result in people losing coverage because of paperwork.
Exactly.
And that will be the worst, one of the hardest things will be how onerous that, speaking for Angela and I can tell you where community health centers will jump in there, is we will be sending our outreach teams to help facilitate that paperwork requirement, which will then require that we remove them from doing other community functions supporting the health and wellness of our communities, because they're going to be busy trying to get paperwork done to keep people enrolled.
As Mr. Mark Thomas said, it's the first thing, you put it back on the hospitals. So you're just going to inundate the hospitals of people. ER, inappropriate and ER utilization is going to go up. I know there's studies that have shown that with Medicaid expansion, it's gone down because people have access they're able to call their doctors, or they're able to go to urgent care instead of going to emergent care. So it just impacts all levels of folks' lives.
Can I say also, from a veteran standpoint, a lot of those federal workers who got fired or were told to retire are veterans. So now they have no job, depression is skyrocketing. The VA count is going to increase, but they also a lot of those folks were let go. So who's going to be around to take care of us? You cut the VA workforce, and you're going to get an increase in veterans seeking help. You know, that's also going to be a ripple effect.
Any final comments?
Yeah, I'll just make one final comment. I think I grew up in Norfolk. I think Hampton Roads is a very special place, and one of the main reasons, if not the main reasons, it's a special place is because of our military presence here. I feel that we have a privilege to serve that active duty dependent patient population, probably larger than any other children's hospital in the country. What we just want folks to understand is that cuts to this program have real impacts, and it's to impacts folks like our active duty military dependents. It's impacts to the folks that are real rural or hospitals, and challenges that they might have to have impacts on as well. So it's expansive. And we just need to make sure that we're being very clear-eyed about it when we're talking about the cuts, the major cuts to the program.
Well, that's the last word. That would be the last word. Thank everyone for coming. I think we're going to do everything we can to make sure that the Medicaid program is not cut. We point out that even with these drastic cuts, it doesn't fully fund the tax cuts for the wealthy. If the budget passes, it will end up with a budget deficit worse than doing nothing.
Yeah.
And so you inflict all that pain and end up worse off than you started. So thank everyone for coming. We'll continue the fight.
We appreciate it.
Thank you so much.